panel expert and moderator. I am Dr. Mozumder, Asian Professor Rangamati Medical College. Today my topic is biomechanics of the hip joint. Next. The term biomechanics, first coined by Soviet neurophysiologist. This word comes from ancient word bios means life and mechanici mean machines. Next, please. So biomechanics means study of the structure and function of the biological system by means of method of machines, mechanics. Next. Why we should learn biomechanics? Because to perform the procedure properly, to manage the problem that may arise during and after surgery successfully, to select the component intelligently, and to counsel patient concerning their physical activities. Next, please. The objectives of this talk is biomechanics of the hip joint. Then I will cover the kinetomatics, kinetics, free body analysis and diagram, determination of joint reaction force, and then biomechanics of the hip and hip instability. Next, please. Look at the normal hip. This is a ball and socket type of joint, which is highly congruent, well lubricated, and joint is compliant, and it is very, very stable. The anatomy of the joint, this is ball and socket joints, the bony anatomy. Next, this is the bony anatomy. It's a head acts as a ball and cystole as a socket, then ligamental and capsular anatomy, then neurovascular anatomy. Press, please. Then neurovascular anatomy, then muscular anatomy. Muscular anatomy is very important for biomechanics. Please, next. I want to introduce one term that is statics, dynamics, now kinetomatics. The study of motion with respect to the relationship between the displacement, velocity, and acceleration without concerning of motion. Kinetics relate to the force acting on a rigid body to its resulting motion. And kinetic is the study of human motion. Next. The force, a push or pull on the object resulting from the object interacting with another object. Quantity that contains both direction and magnitude. Force and velocity can be broken down into the vectors. Moment. The tendency of a force to rotate a body around the axis. The moment equal to force into distance. Next. Orthokinematics movement. Hip joint, we know that hip joint is highly congruent, but femoral head is not round. There is a migratory movement, ball head in the acetabulum. Head basically spin around during the varying degree of extension, flexion, abduction, anteriorly and posteriorly. Next. Structure abducting to the weight bearing. Look at the picture that head, arm, and tongue force act on the head, and ground reaction force Two forces act parallelly and connected by a momentum, which create a torsion force, and that's resulting in, next please, that's resulting in a torsion force in the neck. So there is a tensile force in the superior part of the neck and compression force in the inferior neck. The trabeculae actually follow this force. Next. Next, please. Then femur, when body force act on the femur, actually is create a compressive force medially and tensile force laterally. Next, please. Motion of the pelvis on the femur. When the hip joint is weight bearing, the femur is relatively fixed, and motion of the hip joint is produced by movement of the pelvis on the femur. First, head is tilt posteriorly when it is extended and tilt anteriorly when it is flexed. Please, next please. And on lateral tilt, and axis on lateral tilting, when axis of the femur and axis of the pelvis that is plane to the anterior superior extension, the medial angle is more, that is the abduction, and where medial angle is less, that is the adduction of the hip joint. Next. Hip joint force and muscle function in instance. First, bilateral stance. The line of the gravity falls just posterior to the axis of the flexion extension of the hip joint. In the frontal plane during the bilateral stance, the superincumbent body weight is transmitted through the sacroiliac joint and pelvis to the right and left femoral heads. Joint axis of each joint lies at the equal distance from the line of the gravity of the body weight. The gravitational moment of the right hip joint and the left hip joint are equal. So because the body weight on each femoral head is same, so the momentum of these two joints should be equal. Next. That is WR into DR equal to WR into DL. Next. The gravitational torque on the right hip and left hip occur opposite direction. These two opposing gravitational moment of the equal magnitude balance each other, and the pelvis is maintained in equilibrium in the frontal plane without resistance of active muscle. This is the picture showing how the pelvis lies in equilibrium in bipedal stance. That is, in the center there is the active body weight, and the right and left there is the abductor momentum, and DR and DL is the momentum of body weight. Next, please. In unilateral stance, the left leg has been lifted from the ground and the full superimposed body weight is being supported by the right hip joint. The weight of the non-weight bearing left limb that is hanging on the left side of the pelvis must be supported along the weight of the body by right hip joint. Of the one-third of the portion of the body weight found in the lower extremity, the non-weight bearing limb must account for the half of that, or 1/6 of the full body weight. The magnitude of the body weight compressing the right hip joint in a right unilateral stance, therefore hip joint compressing body weight in unilateral stance, that is 2/3 of body weight plus 1/6 of body weight, that is 5/6 of the body weight. Look at the picture. This is the when a single line stance, there is a body weight momentum that is 10 centimeter and abductor momentum that is 5 centimeters. That's why more force acting on the single line, that is 4 times of the body weight. Next. Compensatory lateral lean of the tongue. The compensatory lateral lean of the tongue towards the painful stance lean will swing the lean of the gravity closer to the hip joint, thereby reducing the gravitational momentum. It does reduce the gravitational torque. Look at the picture. If please back. Please PBS. Look at the picture. Look the when. Please next. Look at the picture. When body lean on the apetic side, the gravitational force momentum is reduced from 10 centimeter to 2.5 centimeter. That's why the joint reaction force is reduced. Next. If we use a cane on contralateral part, the latissimus dorsi momentum comes. That's why in the cane, the momentum is about 50 centimeters, but latissimus dorsi momentum is 20 centimeters. That's why in affected hip, there's a joint reaction force reduced and abductor should not have to work less. Next. Next, please. Next. Hip joint is a first class lever. Please. The joint reaction force. The joint, this is defined as force generated within the joint in response to force acting on the joint. In the hip, it is the result of need to balance the momentum of the body weight and abductor tension. Look at the picture. This is the first, the hip joint act as a first class lever. The where pivot is the femur and body weight in one side and abductor force in another side. The joint reaction force is equal to body weight plus abductor force. Next. Next, please. So, to maintain a stable hip, torque produced by the body weight is countered by the abductor muscle pull. Look at the picture. The body weight and the abductor force. Abductor have to work more than the body weight because the abductor momentum is less than the body weight momentum. Next. In normal hip, determination of joint reacting force are body weight momentum, abductor force, and abductor force momentum. Next. Look at the pictures. In first slide, the body and the vector, please, previous slide. Previous slide, please. Previous slide, please. Look at the pictures. Next. Look at the picture. The red line is the body weight vector and the green line is the abductor force vector. So this vector make a resultant vector that is the in yellow line, that is an R, that is the joint force reactant force vector. Next. The total force, because of in single instance, the vectors, body weight vectors is deviated from the affected joint, so body weight rise to the 4 times on the body weight. Next. Kinetics. The force of the normal hip is inverse. In normal working, it is 3 times the body weight. It rises to 7 times in fast riding, SLR, which means straight leg raising, it is twice. In running, it is 10 times. Sitting on chair unaided, it is 4 times the body weight. Free body analysis. In single leg stance, I already told the weight of the leg is 1/6 of the body weight, and abductor muscle action force is the primary stabilizer of the pelvis in single stance. Lever arm. Lever arm, this is the distance between the point of the action of the force and pivot. Archimedes used to say, give me a place to stand and I shall move the earth with it. Next. The two-dimensional analysis of the force. In bipedal stance, central gravity lies in between the two hips, and in single leg stance, effect of the central gravity moves distally and for the supporting leg. Next. It's already discussed. Next, please. Hip disorders. The pathomechanic factors of the hip disorders are increased body weight momentum, decreased abductor force, and decreased abductor force momentum. So management of painful hip disorder is aimed to reduce joint reaction force, that is body weight plus abductor force. The studies to reduce joint reaction force is the reduction of body weight or its momentum and help the abductor force or its momentum. So body weight reduction is the main target to reduce the hip joint pain. Next. Then reduction of the body and momentum. So how can we body weight decrease the joint pain? That is, please. As per example, in Tandalwar gait, decrease body weight or momentum, decrease joint reaction force, that lead to decreased joint pain. Next. Next. We can also reduce the joint pain by providing additional movement, that is walking stick in opposite hand. I already explained how this reduce the force. We can reduce the force up to 67% reaction of dorsal force by using walking aid, that is stick in opposite hand. So use of a cane in inspiratory, body weight passes mainly through the cane, but use of a cane in contralaterally, the cane assists the abductor muscle in providing counter torque. Next. Help abductor force or its momentum also can be done by increase the offset, that is by osteotomy and transfer of the gutter torque on its lateral side. Now angulation of the femur. There are two angulations made by the head and the neck of the femur in addition to the shaft. First, angulation of inclination occurs in the frontal plane between an axis through the femoral head, neck, and the longitudinal axis of the femoral shaft. Next, an angle of torsion occurs in the transverse plane between the axis through the femoral head and neck and axis through the distal femoral condyle. Neck shape angle in normal hip, it is 125 plus minus 5 degrees. In Coxa Valga, it is more than 130 degrees. In Coxa Valga, it is less than 120 degrees. Next, in normal heap, the tip of the gutter trochanter and the center of the heap in the same level, but in the Whereas it is the center of the heap is low down, and in Valga's center of the heap is higher. Next. So in Coxa Valga, the gutter trochanter is lower than the normal, reducing the abductor lever up, so increase joint reaction force. In Coxa Valga, gutter trochanter is higher than the normal, so increase the abductor lever arm. This decreases the joint reaction force, but there is an abductor insufficiency. So my biomechanical effect in the valgus sphincterotomy. This lengthens the abductor muscle lever arm, so reduce the joint reaction force. Next. Next, please. And by biomechanics, the angle of torsion of the femur. In adult, the femoral angle of the torsion is considered to be 10 to 20 degree, and 15 degree for males and 18 degrees for female. The femoral inversion is considered to exist when the angle of anterior torsion is greater than 15 to 20 degree, and retroversion is considered when it is less than 15 to 20 degrees. Next. Lever arm ratio. This is the body weight momentum divided by abductor muscle momentum. In single leg stance, the lever arm ratio is 2.5. In total hip displacement, the will be 1:1. The aim of the total hip displacement is to relieve pain and improve friction by increasing offset and lever arm. So what is offset? Medial or horizontal offset. It is the center of the head to the axis of the steel. Vertical offset determined by the base of the length of the prosthetic neck and length gained by the head. The depth the implant is inserted into the femoral canal alter the vertical height. Next. Medial offset is inadequate. The momentum is shortened, so there is a limping, increase bony impulse, so rise joint reaction force, and ultimately fail of the construct. Next. If excessive medial offset, so increase stress on the cement and steel, so increase stress and there is a losing and ultimately fail or dislocation. Next. So adjustment of neck length is important as it has an effect on both medial and horizontal offset. Joint reaction force are minimal if hip center placed in the anatomical position. John Charnley believe it low frictional torque arthroplasty. So friction torque force, what is friction torque force? This is the frictional force into length of the lever arm. The smaller with smaller head. If frictional torque force is more, there may be chance of loosening. Next. So how low frictional torque arthroplasty is achieved? It is by lateralization of abductor and medialization of center of rotation by dipping the socket and using a small head size. This picture shows how the lateralization and medialization of the center and lateralization of the abductor force. Next. So there are four major factors which may be considered for prevent hip instability. That is the component design, component position, soft tissue tensioning, and soft tissue functioning. Primary arc of region. Arc and articulation move before impinging and levering out. Next. Jumping distance. So what is jumping distance? The distance the head need to travel before dislocation occur, usually half of the head of the diameter. So if you use 32 millimeters head, jumping distance is 60 millimeter. For 22 millimeter is 11 millimeter. So if you use a smaller size of the head, there is more chance of dislocation. Next, component alignment, occipital position. The occipital position should be anteversion in 5 to 25 degree, and abduction should be 30 to 50 degrees. Next. Next, please. For femoral stem position, anteversion is 10 to 15 degree, and combined anteversion is 37 degrees. Next. Next, please. So the take-home message is an increase in the ratio of the abductor lever arm to the body arm, decrease the joint reaction force, move the occipital component as far as medially and inferior, shifting the body weight or leaning over the affected hip, whereas neck shift angle and cane in contralateral hands. Thank you very much. Sorry for inconvenience.
Thank you, Dr. Thank you, Dr. Mozumder. Nicely and elaborately present the hip joint biomechanics. Actually, the biomechanics of hip joint is very important, but it is very difficult to understand in hip arthroplasty surgery, but it is important. Now, I like to some question at, but there is no question in chat box still. There is empty. Now I would like to invite the Professor Rizvi sir. Tell something hip joint sir. Sir, unmute sir.
Okay, thank you. So, are you asking for any comment or anything else?
As a whole, sir, biomechanics.
Okay, first of all, thank you very much for thanks to presenter Uddin Mozumder for presenting elaborately presenting a complex issue with a lot of confidence. We know that who are orthopedic surgeons, everybody has gone through biomechanics of the hip in some part of our life. Okay, especially during student life, everybody has to go through this biomechanics of the hip joint, and I am pretty sure many of us has difficulty in understanding biomechanics. I would like to, what do you call it, very understandably understand the whole thing. The biomechanics is so complex. But from the presentation, we do understand that it has a different implication. Okay. Biomechanics of the hip, if you consider that, if you consider a disease, as for example, yes, nicely mentioned that if simple there is change in the angle of the shaft of the femur to varus or valgus, that can give rise to a disease condition. And also, if you deeply think about the biomechanics, that also can help us in understanding the progression of the disease. Not only that, this biomechanics can help us to treat a condition. If you consider the total hip replacement as we do mostly for osteoarthritis of the hip joints, now we know the many of this improvement in the designs of this total hip arthroplasty was based on biomechanics of the hip joints. We know, now we know any change, in simple change in the offset, simple change in the center of rotation, okay, simple change in the version can have enormous effect in the hip replacement. And simple change in the angle of the neck shaft can produce enormous pressure either in the head or in the shaft of the femur, giving rise to abnormal stress in the acetabulum or in the medullary cavity, leading to loosening, leading to failure of this hip replacement. And simple change in the shape of the head, okay? Simple change in the size of the head can give us some biomechanical change in the hip joint, which can help us to prevent the dislocation. Okay. Only when Charlie designed a hip prosthesis with a smaller head, okay, he wanted to improve the longevity by reducing the wear, plastic wear from the acetabulum. So uses a small head, okay. So we call it low friction head. But now we know not only the size of the head is important, the other thing also important, and we have, all these have been possible because of our understanding about the biomechanics of the hip joint. So as we read more, we understand more, and it is not very easy because it has so many implications in the hip joint, and especially if we replace the hip, either cemented or then non-cemented, it has a lot of implications. So we must understand that learning biomechanics of the hip joints and its implication in normal hip, in abnormal hip, either diseased hip, as for example osteoarthritis, or dysplastic hip, or replaced hip, as we do total hip replacement, okay, or hemiarthroplasty. It has a lot of implications, and if you want to do a perfect hip replacement, if you want to have a pain-free hip replacement, if you want to have a limb length equalization, if we want to have a hip joint with a longevity longer than 20-25 years, then we must apply the knowledge of biomechanics in our daily practice. With these few words, I would like to conclude my comment on this. Thank you again, and thank you Zulfiqur for your nice moderation. Okay, Fazul Kashem, thank you. You keep on inviting me. Thank you, and thanks my friends, other friends. Thank you, Jahangir is here, and Subi is here, and so many young friends are here. So thank you, everybody.
Thank you,
Okay,
sir. Thank you for joining and for your valuable and listening comment. Zulfiqur, go to the questions.
There is a 2 question from Lieutenant Colonel Abdul Kader from the Central Africa. What is the importance of ground reaction force? And second question is, what is the difference between the neck length and vertical offset? Sir, I would like to Professor Hassan Masood, sir. Sir, Asamo sir is there? No, sir. Sir, Professor Jahangir sir, please answer this question. What is the ground reaction force and difference between the neck length and vertical offset? From the Lieutenant Colonel Abdul Qadir.
Thank you. Dr. Myen is told about the offset. And we know all about the offset. What is the vertical offset? It is the distance, and it is the distance from the upper. Hello. Hello.
Sir, we are listening, sir.
Oh. And the height, or that is from the center and the lower border, and neck is oblique length. And neck length is related to medial offset. If the neck length is larger, then medial offset is greater. And if medial offset is greater, then it is easy to move, that is, abductor force is less. So if neck length is shorter, abductor force needs more. And so walking may difficult. And what is another question?
Okay. What is the difference between the, what do you mean by the ground reaction force? What is the importance? What is the importance? So,
Hello.
what do you mean by the ground reaction force? What is its importance in the hip arthroplasty?
এই বিষয়ে আমি আলী স্যারের একটা সাহায্য চাচ্ছি।
স্যার, স্যারের কাছে আলী স্যারের কাছে প্রশ্ন আছে আরেকটা, ডক্টর সুবীর হোসেন প্রশ্ন করেছেন। In spine problem, how we can assess the hip biomechanics to compromise and adjust offset? Sir, Ali sir.
Thank you very much.
আগের প্রশ্নটা
স্যার স্যার আগের প্রশ্নটা স্যার ছিল what is the importance of ground reaction force in hip arthroplasty?
Thank you very much, everybody, and I'm very overwhelmed that with the difficult topics, so many of the participants, is more than 50. I appreciated everybody in this to come and join with this difficult talk. It's not an easy talk. This biomechanics is the study of the anatomical structures where we can found the functions and its effect on the movements. মানে আমরা যখন একটা anatomical structure উপরে যদি ওভার ইউজ করি, কোনো ডিজিজ হয়, কোনো এজ হয়, কোনো অ্যাথলেটিক অ্যাক্টিভিটিস হয়, তখন বিভিন্ন রকমের চেঞ্জ হয় জয়েন্টের মধ্যে। সেই জয়েন্টের সেই সমস্ত সমস্যাগুলো আমরা আসলে বেসিক্যালি এই বায়োমেকানিক্যাল অ্যাডজাস্টমেন্ট করে এটা একটা ভালো বেনিফিট আমরা দিতে পারি। এন্ড অর্থোপেডিক পয়েন্ট অফ ভিউতে ইন কোর্স অফ আর্থ্রোপ্লাস্টি এন্ড ইন কোর্স অফ দ্য ট্রিটমেন্ট এন্ড ম্যানেজমেন্ট অফ দ্য পেশেন্ট আমরা এখানে একটা ভালো ম্যানেজমেন্ট দিতে পারি যদি আমরা বায়োমেকানিক্যাল অ্যাসপেক্ট গুলো কনসিডার করে আমাদের চিকিৎসাকে অফার করি। আমাদের স্পিকার খুব ভালোভাবে বলেছেন, সুতরাং এবং প্রত্যেকটা সেক্টরে উনি এটাকে ইম্পর্টেন্স দিয়ে উনি প্রেজেন্ট করেছেন এবং এখানে বল এন্ড সকেটের স্ট্রাকচার থেকে ডেপথ এবং এর চারপাশের যে হিপ স্ট্রাকচার সম্পর্কে আরো ডিটেইলস একটু কথা বলা যেত, স্পেশালি দ্য ল্যাব্রাম এন্ড ইটস ইম্পর্টেন্স, এটা একটু ইম্পর্টেন্ট ছিল। আরেকটা হলো যে হিপ জয়েন্টস তো আসলে বেসিক্যালি হিপ ওয়েট বিয়ারিং জয়েন্টস এবং একটা স্টেবল জয়েন্ট, এবং এরকম একটা জয়েন্টস এর বায়োমেকানিক্স এর ক্ষেত্রে আমাদের এই জয়েন্টস এর যে মেইন বিষয় সেটা হলো যে হাউ উই ক্যান মেক এ ব্যালেন্স। ইটস অল অ্যাবাউট ব্যালেন্স। সো এই ব্যালেন্সের ভিতরে সবচেয়ে বেশি ইম্পর্টেন্ট যে দিকটা সেটা হলো যে অ্যাবডাক্টাল লিভার প্লাস ডিসটেন্স ফ্রম দ্য শুরু করে পারপেন্ডিকুলার যদি আমরা লাইন টানি টু দ্য অ্যাবডাক্টর ফোর্স এবং যদি হেড অফ দ্য ফিমার থেকে শুরু করে যদি বডি ওয়েট মোমেন্টাম পর্যন্ত অর্থাৎ মিডল অফ দ্য সিম্পাসিস পিভিস যেখান থেকে বডি ওয়েট ট্রান্সমিট করে এর ভিতরে যদি আমরা ইকুইলিব্রিয়ামটা রেডি করতে পারি, দ্যাট উইল গিভ আস দ্য বেস্ট in terms of the arthroplasty and the patient management and the pathological situation management. তো এইখানে যে প্রশ্নগুলো এসেছে তার ভিতরে একটা হলো জয়েন্ট রিঅ্যাকশন ফোর্স। আমার মনে হয় এই ব্যাপারটা আমাদের যে স্পিকার আছে তার সাথে আমরা আবার একটু কথা বলতে পারি। আরেকটা প্রশ্ন যেটা এসেছে সেটা হলো যে আমাদের স্পিকার আরো অনেক বিষয় খুব ভালো করে বলেছেন, যেমন জয়েন্ট লুব্রিকেশন, সাকশন লুব্রিকেশন, ওয়্যার অ্যান্ড টিয়ার, জাম্পিং ডিস্টেন্স। এইসব বিষয়গুলো আমার মনে হয় যে আমরা স্পিকারের কাছ থেকে আরেকটু ইনফরমেশন নিয়ে ফার্দার ডিসকাশনে যেতে পারি।
Okay, Manuddin bhai, please clarify the two things, ground reaction force. Hello. And Manuddin bhai, শুনতে পাচ্ছেন?
Jumping distance and suction lubrication.
জি,
Manuddin একটু ক্লিয়ার করতে হবে। আলী স্যার জানতে চেয়েছেন জাম্পিং রিফ্লেক্স, clearing force.
Jumping distance and joint ground reaction force.
বলেন, অসুবিধা নেই। গ্রাউন্ড রিঅ্যাকশন ফোর্স বলেন প্লিজ, ক্লিয়ার দ্য গ্রাউন্ড রিঅ্যাকশন ফোর্স।
Ground reaction force. Actually, every force, according to Newton's law, every force has a same and opposite force, or every reaction has same and opposite reaction. When we stand on the ground or we press the ground, then same force acts in reverse direction. That is the ground reaction force. So we make balance by ground reaction force actually. If there is no ground reaction force, we can't walk. That's why make balance, it is the ground reaction force and a gravitational force. Same force acts equally and different direction. That is the importance of ground reaction force.
Okay.
And jumping
may I add one or few points? Colonel Kader, since he is serving in the army, okay, they are much interested in the ground reaction force. Okay, we know when we strike the ground during our walking, running, jumping, okay, so we generate a force, and Myen has rightly said that according to Newton's law, when he hit the ground, either by a heel strike or by foot during running or jumping, we generate equal amount of force, opposite force, that is being borne by the knee and the hip. Okay, as for example, during normal walking, we generate 3 times more the body weight. Yeah, okay, but if we run or jump, okay, if we jump from a height of 10 feet or 20 feet, so we will be creating an enormous amount of ground reaction force that is being borne by the knee and the hip. That is the importance of this ground reaction force, and especially if we do
a little bit of.
So that is why when we do a replacement surgery, we sometimes advise our patients not to go for contact sports, not to go for jumping. Okay, so that this amount of force generated in the ground by the jumping or by running is not enormous enough so that hip cannot withstand. So this is the importance.
The other issue is that, sir, the joint reaction force is that if we can reduce the body weight, we can reduce the joint reaction force.
Yes.
We use the walking support, we can reduce the joint reaction force maybe of more than 62%. So altogether, if this reaction force can be minimized by the ethical management and logical application of our knowledge on the biomechanics.
Yeah, only body weight. If you can reduce effectively body weight, then it is of help. And otherwise, it is very difficult to reduce the joint reaction, ground reaction force, because we will be doing specific kind of jobs. As for example, a army person has to jump from a height, so he has to land on feet. Then to reduce the ground reaction force to a particular uh, foot, as for example, you will find a lot of talus fracture or ankle fracture because we find patient to jump from the height and land on a single foot. But if you can land, if you can train them to land equally on both feet, okay, then the reaction force can be reduced by dividing the amount of force uh, uh, in the foot, or ultimately for the knees and the hips. Okay, I'm yeah, Kader koi, Kader, Kader can help us what the army people do, teach them to reduce
I'm
the
here,
ground
sir.
reaction force. Our Partho can say a army doctor. Partho can also help us in this regard.
I will tell later on, Grisby. I will tell definitely.
Okay.
I do think that be actually my question to you, the ground reaction force and joint reaction force, both. What is the difference?
Yeah, both are different. Joint reaction force created in the joint ultimately. Okay, and uh, uh, and the ground reaction force, it is the force created by the impact on the ground. Okay, impact of this by the person on the ground, either by the heel strike or by the foot from the jumping or running.
Do you think which one is
The
greater?
other issue is that, yes, please.
One is greater.
Sir, my question is from same Abdul Kader. So what is the importance in replacement of joint surgery and ground reaction force? What is the importance? Any improvement or wear and tear prevent joint reaction force be reduced?
Basically, the forces applied on the joints is being balanced, and that is called the soft tissue balance that we usually achieved in the total hip replacement or total knee replacement. And all these reaction forces that is applied on the joint is being created within the joint and also been augmented by the pressure we are exerting on the ground. So in a equilibrium condition, we have to achieve so that the joints become in a state of equilibrium, and that can give a continuous area of activity so that the frictional component will be less and survivorship will be increased. The most important here that question is the role of the abductor and how we can balance the hip, because the distance, we do not have any role or contribution on the distance after the surgery, which has been achieved at the surgery, that has been achieved. We cannot do anything, but by balance the thing, we can manipulate the hip muscles around the hip in a way so that we can make the joint a condition of balance. Means that the most important abductor is the gluteus medius. We can do the exercise on the medius, a post-abortive period, and for some more time, so that the abductor can give you a kind of balance of the joint, and that can lead to have a peaceful hip arthroplasty. Another issue that is most important, that the trend towards the bigger head and the smaller head was controversial. Nowadays, we found that the jumping distance of the head, because the center of the hip is been changing in different 3 phases of the motions of hip, in flexion, in extension, and in rotation. So the hip is a migratory movement inside is happening.
Sir. Hello. Ali sir.
Not hearing.
And this migratory movement is, if the head size is bigger, the migratory movement will be bigger. Means that if the head size is 32, the jumping distance will be 16, means that half. So the chance of dislocation is less. But if the head size is smaller, which is supposed to be have low friction, said before, is not true. So there is a lot of changes happening, and these are the things has been clearly described in this topic and clearly presented. So I think almost all the questions, especially the hip arthroplasty, wear and tear, hip pathology, pain, application of the stick, and the one issue is not been properly addressed is the gait. And gait with it's a complex system because it depends on the hip biomechanics and association with the biomechanics of the lower limb in terms of the axis of the whole of the lower limb and contribution from the spine and the body weight. So we have, it is very difficult to answer this part at this moment, and it's not necessary according to the topic. Thank you, everyone.
Sir, one question to Amir sir. How you balance the antiversion, more antiversion or more retroversion after surgery, total hip arthroplasty? Sir, Amir sir.
Thank you, Dr. Uddin, for good presentation, and you tell about all in the and details in the biomechanics of the hip. Actually, it is your clinical assessment by which we can assess the antiversion of also in the acetabular component and also the femoral component. We usually use the TAL, transverse acetabular ligament, as a guideline for the placement of the cup, and cup must be parallel, cup margin must be parallel to the TAL. And for the femoral antiversion, we also use the guideline as the lesser trochanter for the antiversion, and we always use the guideline of lesser trochanter and placement of the femoral stem on the 15 degree anteriorly of the lesser trochanter, and that is the clinical guideline. We can also use the C-arm, and also we can use the radiological picture during the antiversion, but it is more time consuming and difficult. So clinical judgment is the important, and your experience is also important. Thank you.
Actually, Dr. Amir Hossain, actually,
yes,
regarding the anti-version, may I participate actually? Professor Rizvi?
Yes.
আমি কি পার্টিসিপেট করতে পারি কিছুটা?
Sure, sure.
Yes, sir.
হ্যাঁ?
Yes, sir.
তুমি না বললে তো তোমার পারমিশন ছাড়া
No, this is not me. Not me.
জাহাঙ্গীরকে দেখতে
He is the moderator.
No need of taking permission, sir. You please go ahead.
You don't require any permission. You don't require any permission.
থাকেন, গেস্ট থাকেন বা না থাকেন, সিনিয়ররা থাকলে আমরা কথা বললে আমরা উপকৃত দেবো স্যার।
না না
বলেন স্যার।
বলেন, অবশ্যই বলুন স্যার।
আমি একটু কথা বলে ফেলি, কথা না, আমি কিছু কথা বলার অভ্যাস আছে আমার। ফার্স্ট অফ অল আইড লাইক টু মানে felicitate my dear, very what different Professor Abdullah our Rizvi actually ওনাকে পরিচয় করে দিতে হবে না উনি নিজের মহিমায় উদ্ভাসিত সুতরাং ওনার পরিচয়ের দরকার নেই is my what different of market familial I like to felicitate and like to extend my gratification honor to the panel of experts Professor M. Ali. Actually, I've got no acquaintance with him, but actually I sent so many patients to him for knee replacement from Sirak, actually, to Apollo Hospital when he was there.
Thank you.
Professor M. Ali, thank you. Felicitate. And I like to felicitate Dr. Amir Ali, Associate Professor, Sohishwaradi Hospital, and my student. I am very proud to get him here, actually. My nose, no proud, actually. Mr. Jahangir Alam, Professor, he is a professor. Software status in Nitor. I like to felicitate and gratified Uddin for his very nice time thesis in the Rangamati Medical College, actually. I like to again gratify our moderator, my student, actually Zulfiqur Rahman of Bangladesh Medical College. The topic is actually the biomechanics of the hip joint, actually. What actually, I was actually a basic subject teacher in Rangpur Medical College in some time also. The biomechanics, what Professor Amari was telling that you should say anatomy more clearly about the hip stability, etc. I think the hip is actually it's a very mobile, very well stabilized joint. It is well stabilized. It is called, somebody was telling, I attended lecture in India by Subir Kumar in Narayana Hospital. And he told actually the hip joint self-closing mechanism. But the knee joint, on the other hand, it is a force-closing mechanism. The hip joint is prone to dislocate. And mobility also is very important. I don't like to say more actually. And I think that regarding the biomechanics, the first order of fulcrum, a liver, it was told already actually, the force across the hip joint is mainly due to body weight and it is due to the abductor forces and joint reaction force. It's three things, combination actually. And joint reaction force and ground reaction force are a discussion of that. Professor will give a brief lecture actually. It is actually getting high with SLR, with stance, with walking, with running, with jogging, etc. like that. I don't like to say more actually. And joint reaction force is always higher than the body weight. That is the point I like to say. Joint reaction force is always higher than the body weight. Walking cane told about this, and tendiner by gait and tendiner sign was there. It was actually one thing I am telling a very old, I'm an old guy, I am telling an old thing. What is the common thing? SSS, sound side facts. That is the formula, main thing. অনেক সময় গন্ডগোল লেগে যায় কিভাবে কোনটা হবে টেন্ডেনবার্গে গিয়ে সাউন্ড সাইড ফ্যাক্ট দ্যাট ইজ দ্য থিং বাই দ্য অ্যাবডাক্টর আমি ডিটেইলসে যাব না কক্সা ভালগা ভেড়া বড় হয়ে গেছে কক্সা ভাগলাতে মনে হয় যে ল্যাটারাল লিভার রিডিউসড বাট দি কক্সা ভেড়াতে সেখানে ল্যাটারাল লিভারটা মনে হয় বেশি হয়ে যায় সেখানে আবার গ্রেটার লিভার লেভেলটা এখানে কমে যায় এক জায়গায় বেড়ে যায় আই ডোন্ট নো But the principle of the total hip replacement, what is the real main principle? Main principle is to lower the joint reaction forces, to minimize the joint reaction forces. What do we need? We need correct inclination. We need to correct the limb length. We need to correct the anteversion. We need to correct the neck shaft angle. That is the fourth thing, very important. You must adjust the abductor lever very nicely and like to preserve the biomechanics, as we were told, as far as possible, Full maintenance is not really, is improbable actually, like to maintain as far as possible. And if there is wrong biomechanics, unexpected outcome, right biomechanics, there is right outcome. And somebody was telling about the offset, vertical offset, medial offset, horizontal offset. The medial offset is very important, I think. That is the idea, if it is inadequate, that is the limb. And I think there is some bony pressure or impingement. But medial offset is high, then the chance of the dislocation and stress fracture, the pressure over the cement, actually like that. You know it better. You are doing more than me. Actually, I am actually not actually. So I am telling something theoretically, something like that. So actually, the this is the thing. So with all, I like to say my felicitations to all participants of this program. I feel personally very much fortunate to remain with you in this very important time-demanding presentation. I am learned many things from you. Thank you very much. Most welcome. Thank you, Rizvi, my friend. Thank you.
Thank you, Patu sir. Nicely share your experience and anatomical things, the biomechanics of the hips. Now I like to request our Professor Amjad sir to conclude the webinar. And after that, Dr. Fazlul Qasim sir announce the next webinar. Now I request Professor Amjad sir.
Thank you very much, Zulfiqur Rahman. Here I'm very happy and I'm listening to you. I'm learning from all of you, my friends, really from Ali, from Partho Sharjishom, and the speaker here. Really, he has presented nicely and many questions. A few questions, although not so many questions, because biomechanics is a কঠিন জিনিস. আমি নিজেও অত বুঝি না ভালো, কাজ যদিও করি অনেক, তো তারপরে অনেক শেখা হচ্ছে এবং অনেক আমাদেরকে মানে এখানে আমি বলবো যে আমরা শিখতেছি। অনেক ডিসকাশন হলো এবং ও ভালো মতো বলেছে। আমি মনে করি যে যেটা বলেছে সে বায়োমেকানিক্স এর মধ্যে কিনেটিক্স নিয়ে আসছে, সেখানে মিডিয়ালাইজেশন, ল্যাটারালাইজেশন, ফালক্রাম সবকিছুই সুন্দরভাবে প্রেজেন্ট করেছে। আমরা মানে কিছু শিখলাম এবং আমি মনে করি যে আমাদের এই প্রোগ্রামগুলো আরো মুগ্ধকর হবে যখন আমরা আরো কেস বেস ডিসকাশন করব। আমি এটা অর্গানাইজার ফজলুল্লাহ কাসেমকে বলবো যে কেস বেস ডিসকাশন যদি হয় তাহলে আরো ভালো হবে, সেভাবে অ্যারেঞ্জ করার জন্য। এবং এখানে যারা স্পিকার এবং আমাদের যারা মানে প্যানেলিস্ট আছেন, জাহাঙ্গীর, প্রফেসর জাহাঙ্গীর, তারপরে আলী and then আমির হোসেন, মনে হয় তিনজনই প্যানেলিস্ট, তাদেরকে অনেক ধন্যবাদ। এবং এখানে মডারেটর হিসেবে জুলফিকার রহমান, অনেক পার্টিসিপেন্ট, পার্টিকুলারলি আমাদের ডাক্তার সাহেব সাউথ আফ্রিকার কাদের সাহেব বারবারই মানে খুব ভালো লাগে। কালকেরও সে অনেক, আমি মনে করি this is our great opportunity to learn these days because আমরা এখন we can't go through the books. So thank you very much, and I would request the panelists and other people that you have conducted, you have nicely given your deliberation, your comments, which are very nice for us, and we are learning. We're all learner. I think I am very much learner because I don't have any knowledge of all these things. Thank you so much, Fazlullah Qasim, for your ongoing procedure of joints, ABC of joints. You have given a nice name, and just go on and inshallah in future. Thank you so much.
তোমাকে তো দেখি নাই আমি এখন পর্যন্ত।
আমি প্রথম থেকে আছি।
না না, আমি দেখছি কিন্তু আগে তোমাকে দেখি নাই।
ঠিক আছে, আমি তোমাকে দেখেছি।
আমি ভাবছি শুধু রিজভি আছে, তুমি নাই হয়তো। আমি ভাবছি তুমি গাড়িতে বসে
তো আমাদের অনেক বড় নেতা, অনেক বড় মানুষ।
না না নেতা বুঝতে তো আছে,
অসুবিধা নাই।
আমি
আমরা all are together, all we want to do
Amjad,
something.
আমরা সবাই
Amjad
এক
was
না না
there.
আমি
Actually,
সবাই আছি, right?
are you in the hospital now, Amjad?
না না
Are you working?
এই যে শার্ট গায়ে দেওয়া
Okay.
ইয়ে
I
করছিল
thought that
আমি তো
showing your name, okay, you went for doing surgery or seeing patient. But nice to know that you are relaxing at home. Okay.
হ্যাঁ আমি রিল্যাক্স
So
করছি, right?
it's nice to see you and enjoy your home environment. Is Bhabhi is
Thank
there
you
at
so
home?
much.
Bhabhi is there. Okay.
Yeah, Bhabhi is
My
there.
salam to Bhabhi. Okay. It's a
Okay,
long,
thank
long
you,
time.
thank you.
I have not seen her. Okay.
Thank you, sir.
anyway আমজাদ আমি একটু কথা বলি প্রফেসর আমজাদ ইজ অলসো মাই ভেরি ওয়ার্দি ফ্রেন্ড আমরা ক্লাসমেট আমি তাকে দেখি এখন দেখতেছি মানে আই হ্যাভ হার্ড ইজ ভেরি নাইস স্পিচ অ্যাকচুয়ালি তো সে কিন্তু হি কেম টু সিলেট অ্যাকচুয়ালি and last year and we had a program on art plastic actually in a Nirvana hotel and অনেক we learned many things from his paper actually. I like to felicitate Amjad again for his nice presentation.
It is because you have arranged it and the patients were from Sylhet.
Yes.
And that is the longest, follow-up for my case, 24 years follow-up. The patient went 3 মাসে হজ করে এসেছে সেই ভদ্রলোক এই হিপ করা এবং এখন তার সিমেন্টেড হিপ তার মানে স্টেম এভরিথিং ইজ পারফেক্ট ইট ইজ রিয়েলি ভেরি মাচ প্রেইজওয়ার্দি তো তার ওয়াইফ
showed this patient to the conference actually
হ্যাঁ তোমাকে ওই কনফারেন্সে পেশেন্ট আসছিল তো অনেক পেশেন্ট এসেছিল সিলেট থেকে
অনেক ছিল
থ্যাংক ইউ I think time is running.
Thank you.
So thank you, sir. Congratulations, Mozumder, for your nice presentation. Though the topic was very complicated, you presented nicely.
আমাদের মনে বলতে চাই
Okay, sir. Then we are grateful to our 3 panelists, Dr. M. Ali, Dr. Amir Hossain, and Professor Jahangir Alam. And we are very much grateful to Rizvi sir and Partho sir. You attended and contributed a lot. We are very much impressed with your friendship between Amjad sir and Partho sir. And we pray God the long live your friendship. And
thank you.
And you are 3 legends of orthopedics in Bangladesh, in education, in practicing, in skilling, and you produce many qualified orthopedic surgeons all over the Bangladesh. Thank you, sir. You please
কাশেম শুনেন এরা কিন্তু দুজন আমার সুখের বন্ধু না দুঃখের বন্ধু দুর্দিনের বন্ধু
স্যার যেহেতু মানুষের জীবনের সুখ এবং দুঃখ দুটাই আছে তো যারা বন্ধু তারা তো সুখে দুঃখে দুই সময় থাকবে
আমার তাদের নাম শুনলে চোখের জল চলে আসে
আপনাদের এই অনুভূতি এই ইমোশন অটুট থাকুক আর আমি সবাই সিনিয়র এবং সব প্যানেলিস্টদেরকে রিকোয়েস্ট করব কারণ আমরা তো একটা স্ট্রাকচারের মধ্যে থাকি এক একটা ওয়েবিনারে 3 জন করে প্যানেলিস্ট থাকে তো যারা প্যানেল এই 3 জনের মধ্যে থাকেন না তারাও দয়া করে থাকবেন লাইক আজকে রিজভি স্যার পার্থ স্যার আপনারা প্যানেলিস্টের মধ্যে ছিলেন না কিন্তু আপনারা ছিলেন এবং আলোচনায় যেভাবে অংশগ্রহণ করেছেন তাতে পার্টিসিপেন্টরা উপকৃত হয়েছে we are thankful to our participant যে আপনারা ধৈর্য সহকারে শুনেছেন এবং যদি আপনাদের যতটুকু লাভ হয়ে থাকে সেটাই আমাদের উদ্দেশ্য এটার আয়োজন করার আগামী শনিবার 5ই সেপ্টেম্বর আমাদের টাইমটা একটু চেঞ্জ হয়ে যাবে স্যার যেহেতু আমরা সবাই বিজি হচ্ছি সো আগামী সপ্তাহ থেকে এটা রাত 9টায় শুরু হবে 8টার পরিবর্তে রাত 9টায় শুরু হবে এটা একটা আরেকটা হচ্ছে আগামী 5 সেপ্টেম্বরের স্যার টপিক হচ্ছে AVN of femoral head preservation plus river versus replacement আমরা কত খানি কত দূর পর্যন্ত এভিয়ান অফ দ্য ফিমোরাল হেডকে প্রিজার্ভ করতে পারে সেটা, এবং কোন পর্যায়ে যায় আমাদেরকে এটা রিপ্লেস করতে হবে এই সিঙ্গেল টপিকের উপরে। এবং তারপর থেকে আমাদের তিনটা হবে স্যার কেস বেসড ডিসকাশন। একটা হচ্ছে অ্যানকাইলোজড হিপ, একটা হবে স্যার প্রোট্রুসিও অ্যাসেটেবুলায়, এবং আরেকটা হবে ডিসপ্লাস্টিক হিপের উপরে স্যার। আপনাদের সবাইকে আবার আমন্ত্রণ থাকলো, এবং আমি সেই সঙ্গে আমাদের সিনিয়র স্যারদেরকে এবং আমাদের যারা অর্থোপেডিক জয়েন্ট রিপ্লেসমেন্ট বোঝেন যারা আজকে প্যানেলিস্ট ছিলেন সবাইকে সব ওয়েবিনারে প্রেজেন্ট থাকার জন্য এবং পার্টিসিপেন্টদেরকে একটু তাদেরকে বুঝতে সহযোগিতা করার জন্য উপস্থিত থাকার জন্য আহ্বান জানাচ্ছি। সবাইকে ধন্যবাদ স্যার। আল্লাহ হাফিজ।
থ্যাংক ইউ।